Hello, welcome to Financial Insider Weekly. I'm your host, Michael Gray, CPA. My guest today is Don Pollard. Don is a Chartered Life Underwriter, which we also call a CLU, and he's also a Chartered Financial Consultant, which is a CHFC, and he's an insurance broker at Advanced Professionals, which is a regional insurance brokerage company headquartered in Northern California, and it serves about 350 clients. The company offers employee benefits and executive life and disability insurance planning. Don has worked in the insurance industry since 1973 and at Advanced Professionals for 12 years. He's managed insurance agencies and trained agents, and he's the incoming president of the Silicon Valley chapter of the National Association of Insurance and Financial Advisors. Today, Don and I will be discussing what healthcare reform means for us as U.S. residents. Now, our purpose here is to give some basic facts about the new Federal Healthcare Reform Act to promote better understanding about what it means for us. And as we get started, I want to give you a caution, and that is that this is a huge piece of legislation. We can't cover all the details. And then also, regulations are going to be developed under this act, so there's a lot of unknowns. And so we're just going to do the best that we can to give you some basic facts to get started, because there's a lot of confusion and fear and everything else related to this. And so getting information can help to dispel some of that fear and help us to be a little more comfortable with what's going on, or at least better informed about what's going on. Okay, Don, let's go.
Right.
All right. So, first of all, why was it necessary to pass healthcare reform legislation? What problems is this addressing?
Well, I think the the Patient Protection and Affordable Care Act is an answer to a lot of problems that we faced for many years. And probably the greatest problems that we're looking at are in the area of costs relative to outcomes, relative to medical premiums, and certainly insured care. So we have people in the country that don't have insurance and are unable to get that. We spend 16% of our GDP on healthcare and medical insurance currently. That's roughly 2 times the median of all industrialized nations for our care. And that in and of itself may not be that bad. The problem is that we rank 15th out of 19 countries. When you look at conditions that are amenable to health care, we rank last in infant mortality out of 23 countries.
That's an embarrassment, isn't it?
Yes, it is. And we are tied for last in the healthy life expectancies at age 60. So we're paying a lot of money and we're not getting much bang for that. Over the last 10 years, we've had premium increases of 131%, while wages have only increased by 38% and inflation by 28%. So we have costs running at 3 and 4 times the benchmarks, and that's not a sustainable situation. We also have a situation where the costs of uninsured care are increasing annually, and this falls onto the states. So those are the basic reasons that we've addressed this, and in one of the most talked about and debated acts, probably since the last time when the Clintons did it.
Okay. All right. Well, what are some key components of this act?
You have, I think, 5 main components to the act here. You have your individual mandates, which are applied to people, and you have your employer mandates, and then coverage mandates that are required, and then the creation of insurance exchanges, and of course the revenue generation piece. Again, much debated and maligned.
Yeah, like how are we going to pay for this? Okay. All right. Well, let's talk for a moment about some of the key provisions and when they're going to be effective. Now, as we do this, I want to remind people that this legislation was enacted on March 23rd, 2010. So that's going to be like our anchor date that we're working from here as we explain what's happening.
Great. We start off with in 3 months from the date of signing, which would be June 23rd of this year, for individual people, a national high-risk pool is created. And the purpose of this is to give individuals who have been uninsured for at least 6 months and have a pre-existing condition an outlet to gain the coverage that they need. In 6 months, which would be September 23rd of this year, 2010, then you have some of the more highly touted pieces kick in. The dependent coverage for adult children is going to become effective at that time. So we'll have the opportunity then to readdress children that have aged out because of school.
Right.
Pre-existing condition exclusions for children under 19 will no longer be allowed. There'll be no rescission of policies by the insurance companies, except, of course, for fraud. And then no lifetime limits will be allowed on medical care coverage.
Now that's effective, as we said, 6 months out.
6 months. That'll be September 23rd of this year. Now, in 2010, overall, we have our small employer tax credits that kick in. And for individuals, I see this as a very positive step, because this is probably going to create opportunities for people who work for small employers to have the opportunity to get employer-based insurance. We also have the Medicare RX drug donut hole fix, or the beginning of that fix. And as you may know, on Medicare, the first 25% of drug coverage under Medicare is paid at 25% by the participant. And then there's what's called the coverage gap, or the donut hole, in where the participant pays 100% until they've paid $4,550 out of their pocket, and then catastrophic coverage kicks in. What this first provision is going to address is the donut hole. So anyone that gets to the donut hole will receive a $250 credit.
Okay.
Now, if we move up to 2011, we have another Medicare type fix, where the donut hole will now be reduced down to 50%. And this is by discounts from the drug manufacturers, is what the material that I read talks about. Medicare also will have wellness coverage at 100% covered, with no copay or no co-insurance. So for our Medicare people, this is a great step.
So that means that these people are going to be able to get preventative care, and so that'll help them to keep healthier and reduce costs.
Exactly. A lot of provisions in the bill that are focused on preventive care and wellness type operations, which I applaud. I think that's a good idea. We also have in 2011 a requirement for medical loss ratio reporting, and this is done by either the insurance company, or if the plan is self-funded, that would be done by the employer themselves. And what this basically allows is that in the large group market, 50 employees and above, a company is required to spend 85% of the premium dollar on either medical care or improvement in quality of medical care. So there's a requirement for that. Now that drops, that's at 80% requirement in the small group and the individual market. The Medicare Advantage plan in 2011 will be frozen